Good evening and welcome to Conversations Live, Lyme disease. I'm Patty Satalia. Each year, an estimated 300,000 Americans are diagnosed with Lyme disease, with Pennsylvania having one of the highest incidence rates in the country. We had an overwhelming response to our January show on Lyme disease, so tonight's experts will help us continue the discussion. They'll also take your questions. Our toll-free number is 1-800-543-8242, and our email address is connect@wpsu.org. You can also join us on Twitter. Find us under the address @WPSU and use the hashtag WPSU Conversations. Now let's meet our guests. Julia Wagner is the founder and president of the Pennsylvania Lyme Resource Network. She began her career on Wall Street as a management and business executive until the challenge of Lyme disease devastated her family in 2006. Since then, her work has focused on providing greater public awareness and education about Lyme disease. Dr. Daniel Cameron is an internist in private practice in Mount Kisco, New York, where he has been treating Lyme patients for more than 20 years. He maintains the website lymeproject.com and is president of the International Lyme and Associated Diseases Society, a nonprofit interest group that advocates for greater acceptance of the controversial diagnosis of chronic Lyme disease. And joining us on Skype is Dr. Jane Huffman, a professor of biological sciences at East Stroudsburg University and director of the Northeast Wildlife DNA Laboratory, where she conducts tick testing services. She's a member of the Wildlife Disease Association, American Society of Parasitologists, and the Society for Wildlife Forensic Science, and a past president of the Pennsylvania Academy of Science. That was a mouthful. Thank you all so very much for joining us.
Well done.
Let's begin by getting each of you to describe your personal experience with Lyme disease, and we'll begin with you, Julia Wagner.
Sure. Well, my family actually lived in the city of Philadelphia, and as we were having children, we moved out to the suburbs, as so many do. And this was in 2004, and during the course of that time, we spent a lot of time outdoors in the parks and hiking and running, etc. And I did, in fact, find ticks on our dog and also on my husband, but not being from the area, we really didn't know a lot about ticks. We did, however, start to experience strange symptoms, and it first started with fatigue, not being able to sleep at night, and other kind of odd things. We noticed in our children that different behaviors were changing. And for myself, I had just this tremendous feeling of being run down. We then actually went on a trip to New England, and it was a beautiful vacation on the coast of Maine and New Hampshire. We were at a farm, and at that trip, my son got very ill, and he spiked a very high fever and had a rash all over his body. And we were thinking we needed to take him to an emergency room because it was quite sudden and quite serious. And just as we were beginning to think about doing that, his fever started to come down. And so we decided not to, but very quickly after that, my daughter got sick. So we cut the vacation short and we went back home. And within weeks, we all started with strange symptoms. My daughter, who was a dancer at the time, could no longer walk on her feet. They gave her tremendous pain, and her entire personality started to change. She started crying and whining and lots of, very unusual emotional behavior, which sounds like a normal kid, right? Acting up. So it was a bit odd. And for myself, along with the fatigue, I started having difficulty remembering things. So I was a very, career woman. I had my own management consulting firm at the time. I worked with C-suite CEO level executives, and my ability to think quickly on my feet, to be articulate, very important. And I began to feel that I was stumbling over words. I couldn't remember things.
And so this is something that's happening throughout your entire household.
Yes.
When did you connect the dots, or did you ever connect the dots and get a positive diagnosis of Lyme disease?
Well, we were very lucky because in my case, the illness went very fast. So I became very seriously sick within a period of 3 to 4 months. And that's not normal. Some people progress more slowly. By the time we knew it was serious and I was going from doctor to doctor, I couldn't remember much. I couldn't drive anymore, and I was no longer working. And our kids were severely ill. No doctor could really figure out what was wrong. and we had no diagnosis. We had suspected allergies, and at one point it was a carcinoid tumor, and I had a test that the injection alone cost $5,000 for, which was meaningless for us. It gave us no answers. It was actually a neighbor that tipped us off, that mentioned that we should look at Lyme disease. And it was my husband and I who got on the internet after someone mentioned it. And lo and behold, many of the symptoms that I was having were there to be found with the diagnosis of Lyme disease.
And so you did have a definitive diagnosis?
Well, certainly at that point it was just an idea, and it was a possible diagnosis. And then we were referred to a physician who very quickly sized us up and did some very broad testing, and I did not come back with a fully positive test. I came back with a band or two. However, our children...
And you're talking about the Western blot.
About the Western blot, and he actually skipped the ELISA, which I'm sure you're going to talk about, and went right to the Western blot. I did, however, our children had a positive test. He also assessed us for co-infections, which I'm sure you'll talk about that.
Okay.
So a full year really took place before I was
diagnosed.
actually,
in some respects, that was very quick, because others have experiences that are much worse than that.
That's
Dr.
right.
Cameron, explain your experiences with Lyme disease.
Well, I'm trained at the University of Minnesota in medical school, Mount Sinai and Beth Israel, Manhattan. Started my practice in New York in the Hudson Valley, but 3 patients of mine in 1987 came along with quite unusual presentations, nothing I had seen in medical school, nothing that I'd really gotten to know, and reading what was already published led to a whole different conclusion. And just as I was getting to know these cases of Lyme disease, in 1990, the New England Journal of Medicine described chronic neurologic Lyme. And I realized that I wasn't the only one, that there were, in these professional journals, these patients have become chronically ill. They weren't just the rash, and they were in trouble, and it was what my experience was.
Well, interesting you should say that, because there is this raging debate in the medical community over what you're calling chronic Lyme disease, and what other organizations, the NIH, the American Academy of Neurology, is referring to as post-treatment Lyme disease. And this is about more than semantics. What's the difference, Dr. Cameron? What's the argument here?
Over and over again, we find that at least a third of people who got treated with 3 weeks of antibiotics are sick, and chronically sick. There's 4 NIH trials, neurologic Lyme, persistent Lyme, post-Lyme, all showed these patients are there, they're enrolling in trials, they're severely sick, and it's difficult to treat. Now, a lot of times it's because they've been sick for years before they get treated.
And so timing is key here.
Yeah, the 2 groups, one group, including the Infectious Disease Society, says it doesn't exist, that they're not sick. But the literature is so supportive of patients, so supportive of how sick they are, that when I was president of ILADS, I published with ILADS treatment guidelines that, looking at the published evidence, you can clearly conclude that they're sick, and that you can make a clinical judgment, you can use your experience as a doctor, and you can treat these people. You might have to treat for various infections that are in that same tick, but it's a very successful treatment protocol.
I want to move to Dr. Huffman in just a moment, but I have to say right now, the American Academy of Neurology, the National Institutes of Health, they say that ILADS guidelines are, they don't endorse those guidelines or the treatment that ILADS suggests. How do you respond to that?
Well, clearly doctors are divided on many topics over the years. Like the most common one was, should you treat ulcers with surgery
or antibiotics?
Or antibiotics, and the antibiotics eventually won.
It took someone had to infect themselves to get that conversation started.
Yeah, sometimes novel treatments capture the imagination of the public. Yet, so far, through the internet, through patients being sick, so many people being sick, those 300,000 people with Lyme every year that the CDC counts, many of them get in trouble. They know the problems. It's just taking a while for a dialogue to take place. Right now there's an impasse, and ILADS exists to continue that dialogue, push for the patients getting better, our patients in our practice, and we're going to continue to push even if there's some opposition.
Yeah.
Dr. Huffman, we'd like to get you to join the conversation. Tell us a little bit about your experience with Lyme disease.
Well, I started at East Stroudsburg University 28 years ago, and again, my focus was on different types of parasitic diseases. And I remember in 1993, 94, we decided to go ahead and do a little survey of Smithfield Beach, which is right at the right by the campus, and we found 3 Ixodes ticks in like 3 weeks of trying to find ticks. And what we noticed, as time went on, that the numbers kept increasing and increasing. And we decided to just go ahead and look at them for the occurrence of Lyme because we're right across the river from New Jersey. And lo and behold, we began to see, ticks that had Borrelia, infected with Borrelia. And I think the most important thing that we were finding also was that there was lots of concurrent and also tri-infections in the ticks. We'd have Babesia, Lyme, Bartonella infected ticks as an adult. So, as time went on, that was what we were looking at in my laboratory, was doing surveillance to see what was out there in Monroe County, looking for hotspots for Lyme, and then also investigating the role that wildlife plays in the perpetuating the organisms in the environment.
It's interesting that you mentioned some of the other illnesses or bacteria that these ticks carry. The focus is always, it seems to be, on Lyme disease, but so often the people who are suffering from, whether you call it post-treatment Lyme disease or chronic disease, have co-infection. So if you'd talk, if you would please, Dr. Huffman, about the other bacteria that these ticks carry.
Okay, along with Borrelia burgdorferi, which is the agent of Lyme, we were also finding that the ticks in Monroe County have Borrelia miyamotoi, which is another type of spirochete, but it causes what we call relapsing fever. So that one, is present, and it's something that, the physicians should be aware of in terms of testing for that one as well. The Babesia is a protozoan infection. It infects the red blood cells.
And it affects us like malaria might.
Yes, it does. It infects the red blood cell. You have and most often, we can really handle the protozoan infection. Those who are immunocompromised, have some other illnesses, can be hit pretty hard with the Babesia infection. And then Bartonella is another infection that we see, as well as Anaplasma, which is... And
Bartonella is something that we sometimes refer to as cat catch fever.
Yeah, cat scratch fever, yes.
Right.
Scratch fever, yeah, cat
Say that 5 times.
Yes, that's another one that is present as well. Henselae, Bartonella henselae is the species that we look at in the ticks.
Okay, I want to talk a little bit about just how prevalent these ticks are in Pennsylvania, and I ask that because according to the CDC, 95% of reported Lyme disease cases are concentrated in 13 states in the Northeast, with Pennsylvania always or consistently ranking among the top 3 states. And I know that you have been testing ticks for Lyme. Give us an idea of how thoroughly you've tested the state and what you've discovered, Dr. Huffman.
Yeah, we've focused on Monroe County, but we have colleagues. We have another person we work with in Lehigh County. He's tested ticks. We're finding, on average with the nymphs, maybe 25% infectivity, and then adults can range from 25% up to 50% infectivity with Lyme. So it's fairly prevalent.
So half of them. So you've got a 50-50 chance if you have an embedded tick. I know in Center County, I read on this website, it's 49.5% tested positive out of 97 ticks that were tested in the county where we are right now.
Right. And I think what's really important, that what we should do in Pennsylvania is do a better complete surveillance, because you may be getting hotspots. We've referred to certain areas where you may have a high occurrence of the spirochete in the reservoir host, and therefore your ticks are going to have a high prevalence as well. So it will be important to survey the state and get into other townships within counties to get a better profile of what's out there.
If you could, Dr. Huffman, explain how the bacteria is transmitted from the tick to humans.
Well, it's really an interesting process. The spirochete is located lower down in the gut of the tick, and as the tick takes the blood meal, that warm blood actually activates the spirochete to move from the gut of the tick into the circulatory system of the individual that's been parasitized. So it's a really, it's an interesting phenomenon. And again, I know there's always controversy, but we look at an 18 to 24 hour time period for that tick to get the spirochete to get activated to leave the gut of the tick and enter into the bloodstream.
Dr. Cameron, if it sounds like a lot of people can be bitten by a tick and end up not with just Lyme disease, but Bartonella or some of the other infections that she was talking about. Do antibiotics work for all of those various illnesses that could be transmitted with one bite?
Well, the reason we call ILADs that name is it was Lyme and associated diseases. So that was a great description of the cesspool of different type of bacteria and parasites in each tick. So when we take on a case, often if it's a parasite like Babesia, the standard doxycycline isn't going to do the trick. It's only going to work on the Lyme. So often, if you just follow up somebody with a tick bite and follow up somebody that's gotten Lyme, you're going to find that if they're still sick, if you go a little deeper, you're going to find one of those other types of infections that are part of the problem, or maybe it's a different strain, like the Morimotai new one strain and species that's on the radar now. That wasn't even discovered when they did the standard ELISA and Western blot. So these old tests, these old ELISA, old Western blots are based on our first observations from 25 years ago. They're not adjustable to all the new bacteria and parasites that we see in somebody infected.
And so for you, how important is it that someone have a positive diagnosis from one of the available tests today in order to start treating them for Lyme disease?
Well, at least a third to a half will get something on their blood test. So it's always encouraging to get a few clues for different infections in that blood test. So I always encourage at least doing a Western blot and ELISA. But there's so many new infections emerging and new strains, new protein, that you really can't live with that test. You're going to have to eventually, as a doctor, use your own clinical judgment, go a lot further than a test, ask all the questions, put the whole story together, bring some consultants in, make sure it's nothing else, and make some judgment, make some decisions. Because
so many of Lyme disease symptoms are also present for someone who has lupus or arthritis or fibromyalgia, for example.
Well, a lot of those situations, I see somebody who's been to an infectious disease doctor, and the infectious disease doctor says, well, I think it's psychiatric. And then they'll go to a rheumatologist and they'll say, well, I think it's fibromyalgia, which is no test for it either. It's just they poke on a few spots and it hurts. And then they'll go to another specialist and they'll say it's chronic fatigue or it's multiple sclerosis. And they're still sick. And it's very difficult to get better. And if you've been sick for months at a time and years at a time, you know, there's too much knowledge, too much research out there that says, look again at a tick. Look at somebody else. The doctors are about, you can't wait for this dialogue to get over with. At some point, you're sick, you should look at the different medical opinions that are out there.
All right, let's take some emails and some phone calls. We'll start with Dale, who's calling us from Erie, and then we'll get some emails that have come in. Dale, go ahead, please.
Yes, I wanted to ask about, my father got bit, it was the late 1990s or the early 2000s. And he was the only person in Erie County to be diagnosed with the Lyme disease when he was bit, and he had arthritis, and the arthritis got really, really bad. And he used to like to, the state park we got around here. We've grown up around the place, and we all, go to the state park. And he used to love to swim and fish and everything else down there. And we think that's where he might have picked it up. But regardless of that, my question was, I had heard many years later, closer to, I think it was like 2010 or 9, that there was supposed to be some kind of a vaccine, but you had to take it prior to the being bitten or something. And I'd only heard this as, hearsay, basically. I didn't hear it from a medical professional or anything like that, and I was
Actually,
wondering, is there a status for, some kind of a vaccine or whatever for Lyme?
there was a vaccine. It was introduced in 1998 and it was withdrawn in 2002. Can you tell us a little bit about it, Julia, and then I'll go to Dr.
Sure.
Wagner.
I'll have Dr. Cameron also talk about it, but the original test was rushed out, I think, because there was a concern about the increase, and it was pulled from the market
By the
basically they
manufacturer.
said that by the manufacturer. The statement was because there wasn't enough sales. However, if you do Google, you can get into the documents that demonstrate that, unfortunately, there were some patients who have a certain genetic type or profile who actually got the disease and did have joint disease and many other things as a result. So there was kind of a mixed story about whether or not it was effective or not, and it was pulled from the market at that point in time.
And in fact, the American Academy of Neurology would say that there were claims that there was arthritis caused by it or Lyme disease caused by it, but they say it's not definitive.
Well, I think anybody can Google and actually see the lawsuits that were filed, and there's a lot of evidence and a lot of data there, so I welcome anyone to do that. And I'm sure Dr. Cameron can add to that as well.
Well,
And it is one on the horizon.
we need a vaccine.
Yep.
The concern on the horizon is that that we don't want to run into troubles with the vaccine, because whenever you deal with such a complicated organism like a spirochete, or the babesia or the Ehrlichia, anaplasmosis, all the things that are in a tick, is that the patient communities wants to have something that works. The doctors like myself who work with those who have chronic troubles want one, but we got burnt the last time. It didn't seem to be what we really were looking for, and so they haven't engaged us as well as we'd like to work together to come up with a vaccine, and we'd like to get something, but we're not sure this is going to work, but they haven't talked to us enough.
Well, Lymerex is the vaccine that was introduced in 1998, and it supposedly provided 80% protection after 3 doses, which sounded like something that you'd have to get like a flu shot.
That's
every
right.
year you would need this vaccine. So I'd like to ask you, Dr. Huffman, what would be the properties, I guess, of an ideal vaccine, something that would work against some of these critters that you're familiar with because of your work?
Right.
Well, I know the vaccine now that they have for dogs that was developed at the University of Pennsylvania, what that does is it actually selects for one of the outer surface proteins from the spirochete. And so that's what you generate the antibodies against. And so as the tick is feeding, those antibodies go into the tick and prevent the spirochete from even getting into the individual. So that's the ideal type of situation.
For humans.
For humans,
Okay.
where you can actually then select for a protein from the spirochete that prevents it from even exiting the tick and getting into the individual. So that is what they are working on. That is the basis for the previous vaccine, only it just wasn't as effective. So I think that would be ideal, where you don't even give the spirochete a chance to get into the host.
And to answer, I think, Dale's question a little more completely, his father contracted Lyme disease. So could someone, Dr. Cameron, who contracted Lyme disease, could they benefit from a vaccine potentially? I mean, once you've had the disease.
Well, it's not clear a vaccine is going to help, because in the real world, you get bit with Lyme, even if you get successfully treated, you can get infected a second time, a third time. And so having been chronically ill with arthritis, there was always that burning question, how do you know what's a vaccine, even if it was available? How do you know what's repeated bites over the years and what's old age? It's very easy to blame everything on old age. I have 30-year-olds who think they're getting old, blame that on the teenagers who think their growing pains getting old. And if you look a second time, there's actually something going on.
You wanted to add something,
Well, I
Julia.
think it's great because a vaccine would be tremendous if it works, but we have to remember that there are other diseases that you get from ticks. So when we talk about the tick data that Dr. Huffman was sharing with us, my family's a perfect representative sample, because we have babesiosis, we had Bartonellosis, we had mycoplasma, as well as Lyme. And they are treated with different things and they present with different symptoms. So the picture is complex, and if there's a vaccine for Lyme, it's solves a piece of the problem, but not necessarily the whole problem. And, you know, I think the more that this is studied, there's great research out there that shows us not only now that the ticks carry this, but also the patients have these multiple diseases. So it is bigger. The only thing I'd like to add to that is, as we were talking about chronic symptoms, Dr. Cameron pointed out that they may, in fact, be treated for Lyme, and then there's still lingering symptoms, which may be another disease. And there's research that shows that if you have Lyme with babesiosis, it's much more difficult to treat and it's much more serious. Most of the studies that have been done on Lyme disease have just looked at Lyme disease in isolation. They have not studied patients
co-infection
that
is
have
really
Lyme,
common.
Babesia, Bartonella, which some of them actually compromise the immune system. So then you have an immune system that's overloaded. So nobody has studied those patients, and we are those patients.
Okay, and I want to get back to you in a bit about what your journey was, your treatment journey. But we do have an email that I'd like to go to first. This is from Denise. She writes, is there a topical ointment to put on a tick bite to use as a preventative, even if it isn't 100% effective? And I guess I'll start with you, Dr. Huffman, on that.
Not that I know of, there isn't any ointment out there. I'm not sure what she's referring to. Is she referring to an ointment that would then allow you to remove the tick, or the tick's been removed? Again, I really can't answer that question. I'm not really sure what she's getting at.
Okay, and I'm not either, but now that we've talked about removal of a tick is critical. So could you tell us how to do it properly?
Well, the proper thing is to either use a tick removing device.
I have to say I have one with me.
You have one with you. I have found by looking at all different types and models that one works quite effectively. It's you do insert it right at the entrance point of the tick, and you do twist, and it allows for the tick to back out, so you're getting the complete head, the capitulum of the tick is removed completely, so you don't leave that little part of it in the skin, which can cause a bit of an infection. You know, they have dirty mouths, they've been out in the woods, so that works very effectively. You don't want to try to put Vaseline on it. You don't want to try to burn it out. Some people say light a match and then blow it out and put that on the tick. They're kind of, those are the myths of Lyme disease or tick removal. So I do recommend using, you know, either the tick remover that you're demonstrating or a really good pair of forceps to try to get in there and remove it.
All right, we go to Brad, who's calling us from West Decatur. What's your question or comment, please, Brad?
I had Lyme disease twice, and the first time it was pretty severe. I didn't catch it very early. The second time it was confirmed. I had caught it a lot earlier, and it wasn't nearly as bad. This has been about 10 years, and it seems to me that I have chronic symptoms, a lot of joint pain. From time to time I get the feverish feeling without actually having a fever. And I guess my question is, at this point, what is the recommended treatment? You know, I don't want to be habitually on antibiotics to treat it. So, you know, what is the treatment for chronic symptoms?
All right, good question. Dr. Cameron?
Well, I think that he's well aware of what Lyme feels like. It's so different than your average cold, flu, stomach virus, and so he's recognizes the symptoms. So it's important for him to sit down with a couple different doctors and see is there something that we can do. Sometimes, you know, they'll go to an infectious disease doctor, rheumatologist also, and they'll go to the primary. But if they're still sick and they were to sit with me in my office, I would look a second time at could there be another bacteria or parasite that was never treated. If they only got doxycycline and that's all they ever had, maybe a different antibiotic like amoxicillin might work, and that's cheap, inexpensive, well tolerated. Maybe they have two infections at once. So if they're indeed sick and you can't find a reasonable answer, you might treat. Sometimes people though have real subtle issues and they might just treat the symptoms. It's very important to watch their diet anyway. Tell them that maybe if they want to just watch sugar, he should watch his sugar, stay away from alcohol, exercise. see what he can do with his body too.
And in fact, one of the things ILAD says that is a factor in whether someone recovers or not is, one, get enough rest, two, avoid alcohol, and what's the third one?
Be careful, simple sugars, processed sugars.
Yeah,
and it goes a long way. Sometimes, for his situation, he should try that first, see if that's enough. If it's not, he should know doctors are divided. Some
non-compliance is the third.
Some doctors are divided, but still, look at different views, and if he's still sick, there might be some treatment out there.
Besides antibiotics?
Yes.
Okay. If you're just joining us, I'm Patty Satalia, and this is Conversations Live, Lyme disease on WPSU TV, WPSU FM in Central Pennsylvania, and on WQLN TV in Erie. Our guests tonight are Julia Wagner, the founder and president of the Pennsylvania Lyme Resource Network, Dr. Daniel Cameron, president of the International Lyme and Associated Diseases Society, and Professor Jane Huffman, director of the Northeast Wildlife DNA Laboratory at East Stroudsburg University. Our telephone number is 1-800-543-8242, and our panelists are ready to take your phone call. If you'd prefer to email us, our address is connect@wpsu.org. You can also join us on Twitter. Find us under the address @WPSU, and use the hashtag WPSU Conversations. I'm going to go now to Marianne, who is calling us from Edinburgh. Go ahead, please, Marianne.
Good evening. I'm interested in your conversation about Lyme disease, because I had Lyme disease for roughly 25 years before I was diagnosed. My first symptoms was acute arthritis. Then I had flu symptoms, just one thing after another. I wore a heart monitor for a month because my heart was palpitating and nothing showed up on the monitor. And I took the antibiotics for nearly 2 years, a series, changed once a month. And I did go into remission for about a year and a half. And then the Lyme disease came back, and it came back with a vengeance.
And how are you right now?
And a friend of mine gave me an article about a doctor in Denver that had come up with the idea of using vitamin C injections. And I took vitamin C injections, 50 cc, twice a week for 8 treatments. And thank the good Lord, I'm cured.
What's your reaction to that, Dr. Cameron?
Well, there's more than one approach to when you treat Lyme. So that's why I start with diet and alcohol. I do great with antibiotics, on top of that. But there are other people that do integrative medicine type approaches. Now, most of the integrative medicine people I see have gotten experience with treatment with an antibiotic as part of the treatment. That very difficult to rely only on supplements. At some point, it sounds like Marianne had taken some antibiotics, and then she added the extra vitamin C on top of that. But I always remind people that at some point, an antibiotic approach is quite useful.
But there is real skepticism about long-term antibiotic use. The American Academy of Neurology and the National Institutes of Health say that there are dangers, risks to patients of using antibiotics long-term. One, there is the problems with gastrointestinal issues, C. diff, infectious diarrhea. In addition to that, dangers, organ damage is another. And then, of course, speeding up antibiotic resistance. How do you respond to that? Because you say you've had good success by using antibiotics longer than is recommended by those organizations.
Well, as a doctor, there's always risk and benefits. So like when I talk about the ulcers, the multiple surgical procedures of ulcers, pumping stomach with ice and multiple transfusions versus taking an antibiotic, the antibiotic went out in that case. In this case is that every time I write an antibiotic, I'm always counseling to take probiotics, be very careful with the diet, because I counsel them that diarrhea is important, that that antibiotics resistance is growing, especially with chickens and cows and all the other things that are used.
Getting antibiotics daily, right?
It's just that chronic Lyme can be devastating, can lead to disability. It can wipe out a 9th grader in high school, so they can't finish high school. They're in home tutoring. My tax base goes up when I have to pay my property tax every year because people are too many sick people
Are on disability.
in Hudson Valley. The families are destroyed. And so if you weigh those two very troublesome things, is that eventually, no matter what society wants, I'm in a room with a patient trying to decide between the risk of antibiotics and the risk of being chronically sick. And if they're sick enough, I might treat with antibiotic. If they're not bad, I don't. I might have to, as I treat, keep adding specialists in to make sure I'm not missing anything. Follow up is so important to make sure you get a good outcome no matter what you pick.
Dr. Huffman, I want to bring you back into the conversation for a moment because I understand that this Borrelia burgdorferi, I can never pronounce that, so forgive me if that isn't quite right, but these are pretty stealth organisms. How difficult are they to knock them out with antibiotics, and how necessary is it to change it up? Because I understand they have to be active, in an active stage and not dormant, and they can be in tissues as well as in fluid within our body, so they seem to be tenacious and difficult to knock out.
I think, well, Dr. Cameron could probably address that answer better than I could, but I know that they are very, as you say, stealth. They can hide out in areas where the antibiotics can't get to them. So I think, as everyone's been speaking about, is there's a lot of research and a lot of investigation that still has to move forward in terms of understanding this organism. In terms of diseases, it's only been around since 1977, so it's a fairly new disease that we need to deal with in the Northeast and in Pennsylvania. And again, it's a matter of physicians like Dr. Cameron documenting and seeing how things work and letting that become part of our data that we can understand better how to treat.
From 2006 until 2011, the total reported cases of Lyme disease in Pennsylvania more than doubled, and that rate is continuing to climb. And so I'm wondering, Dr. Hoffman, just what are you seeing? Are these tick populations exploding, and if so, why? And is there anything we can do to to address the tick population? I mean, we can't spread pesticides all over God's green earth here, but what can we do?
Right. It is very difficult to control the ticks. One of the things that really drives the density of ticks is having a good mass crop. If we have a year where there's lots of acorns present, that drives the number of mice that are out there. And the more mice, the more ticks. And that's what really drives the disease. It's that type of situation where you do have a good mass crop. And then also our deer density. That's also an important component. We refer to the deer as the bed and breakfast for the tick. The males and the females, adult ticks, get onto the deer. They take their blood meal, they breed, and when the female falls off, that's when she lays her eggs. So it is a dynamic, complex cycle in the environment with the deer, with the mice, and also having a good mass crop that drives it. And again, the numbers of ticks have been increasing. This past winter was a great winter for ticks because the snow cover really protected them from being dehydrated. If they're out in the open and it's cold and dry and they get exposed to the wind, they can't survive that. But having the snow cover, they were happy as clams or ticks under the snow cover.
And people are lulled into thinking that ticks are destroyed in the winter, and they're clearly not. You had something to add,
well,
Julia?
There's a couple things. One is the fragmentation of the forests, which we live in suburbia. So what do we love to do in suburbia but chop up those forests and make these lovely little environments, which actually happen to be the best environment for ticks. The mice just flourish, and the populations of ticks just drive up dramatically. So
when you're forcing all of these critters into a
Absolutely.
smaller and smaller space.
That's right. That's right. Well, and the predators on the small critters, like the mice, just aren't there. They're not as prevalent. So those populations can explode, and then you have children playing out in the yards, etc., and all of us playing out there as well. The only other thing I wanted to tack on was when my children were sick and I was sick, we were, torn about how to approach this. And, no mother or father wants to put their children on medicine at the ages that our children were, 4 years old and 6 years old, for any sustained period of time. And our daughter actually had been sick with recurrent ear infections for a year. And over again, she was on antibiotics, which didn't seem to eradicate it. So we were very concerned. And I come from a family with a lot of scientists and medical professionals. And we did our research. We did our homework. And when you get down to it, first of all, antibiotics have been used for many, many years successfully long term. So whether it's tuberculosis or it's mycoplasma, they've been used safely for long term. And there's great data around that. When you look at the studies that relate to the treatment of chronic Lyme disease, actually there are only 4 studies. And when you look at those studies, what I found surprising with all of the literature, in the common news that seemed to say it didn't do anything, was that actually they did improve certain symptom sets. It improved fatigue and it improved memory in some cases. But those improvements weren't necessarily sustained, and they didn't track the patients for much further. So we've had limited studies. It is not true that it proved that it didn't treat or correct or improve. There were improvements.
Well, interestingly enough, it is the Infectious Diseases Society of America that basically dictates to the insurance companies what will be covered. And if they say that long-term antibiotic use is they don't believe in it, then the insurance companies won't reimburse for it. And long-term antibiotic use can cost patients $80,000 a year.
That's right, absolutely. But actually, it's interesting because there's been a shift. We've seen it. I mean, I've had thousands of patients come through our group when we got sick, and I found that incredible information that helped us get the family well. We started a group, and that was locally, and that's now expanded to a statewide organization that you talked about before. But what we see is now there's enough evidence to show that longer-term care actually is beneficial, that insurance companies are covering it more than they did before. We're not seeing the rejections. I'm sure that Dr. Cameron can talk about that as well. And actually, maybe we should have him add his point of view.
And then we'll go to a phone call. Rob, hang on. We'll be with you in just a minute there in Bedford.
Well, there's a lot of people who hear about stories of people being on intravenous and expensive intravenous, but there's so many people that just get better with simple antibiotics. That's a pill that's covered by the prescription plan. And even if for some reason doxycycline or amoxicillin is not covered, it's not that expensive. For 40 or 50 bucks, you can go a long ways. The treatment for babesia is not intravenous anyway. And so you're not really as costly as you think. A lot of the labs are covered by your insurance, covered by Medicare. And so there's a feeling that you shouldn't even try, but there's so many things that are affordable that are well worth pursuing, and to focus only on one treatment, IV, distorts the issue, and people should look a second time.
Okay. I want to talk about Lyme literate medical doctors in a moment, but first I promise Rob, or Rod, I'm sorry, you're on the air, and then I'll go to an email. Go ahead, please, Rod.
Hello, folks. I appreciate the opportunity to talk to you. I live in southern Bedford County area. We live in a very remote area. We live in the woods, so to speak, in the woods. We have dogs that run freely in the woods. We love the environment. I've lost 2 dogs to Lyme's disease. My wife and I have been tested. We've not been said that we've contracted it, but I feel as it's a matter of time because ticks are a daily part of our environment. We see them on a regular basis. And I know it's probably hard to come up with one definitive answer as to how we can perhaps prevent contracting this, because we're constantly picking them off us and our animals.
I hear you.
That environment. But can you give me a few tidbits of what's the best things we can do to try to alleviate that?
Yeah. Yeah. Thank you, because I think everyone has that same question on their mind. I know I certainly do. Dr. Huffman, we'll start with you, and then Julia, if you could pipe in as well. Dr. Huffman?
There are some pesticides out there that one can apply around your house and around the yard. It's called Daminex. It's manufactured in Massachusetts, and they're little cardboard tubes that contain cotton that have the pesticide in it. And as the mouse, they like to build their little nest, they'll pick up those the pesticide that's in the cotton, take it to their den to make their little nest, and that pesticide then kills any of the ticks that are present. So that's one little strategy that can be used. One of the best things that people have found is to have guinea hens or chickens, because they do eat ticks. Wild turkeys will eat ticks as well. So to have them in your backyard sometimes helps in terms of managing the numbers of ticks. Again, there are some companies, some pesticide groups out there that actually will treat an area. But again, you have to have compliance with your neighbor, because you've done it, but then eventually if the deer comes through or other animals come through, they're going to deposit the ticks they picked up from the other yard. So it is a very difficult process, and it's a very difficult thing to deal with.
Julia?
Yeah, I mean, I think this is a great question, because there's a lot that you can do to cut down the tick populations in your yards and in your property. And one is certainly, we do every year, spring comes around and we order the Daminex tubes, and we put them all around the perimeter of our yard where there are bushes, where the mice might be living. But in addition, there's landscape stuff that you can do. You can get rid of the bushes in your yard and the trees that keep the light out, because ticks, if they are dried up, that's how you can eliminate them. You don't want moisture in your yard. So get the sun in, get a lot of that beautiful landscaping that we pay a lot to put in our yards, actually isn't such a great thing if you're trying to prevent tick populations. There's a fabulous website, the University of Rhode Island, it's tickencounter.org. There's a wealth of information there. So I recommend to our caller, Rod, that if he were to research that, he'll find some great strategies.
And this will be on our website after the program.
Good. And then the other thing is, if you are outside, if you're a gardener or you're a hiker, there's a company that's called Insect Shield, and they make clothing that's treated with permethrin, which is a very safe chemical that actually kills the ticks on contact. And in fact, North Carolina State requires all their outdoor workers to have uniforms that have that treatment in their clothing. And in fact, the U.S. Marines also have all of our naval forces that have to wear those kinds of uniforms.
Wow.
My husband is a gardener, and he started after our adventure with Lyme wearing a set of clothing treated to garden, and he really hasn't had problems since then. So there's a lot that you can do, and I recommend that you research that.
Okay. We'll go now to our, are we going to an email or Facebook question? Okay, here we go. We have an email question. This is from Amber. Please address what the general public can do to advocate for proper treatment when the inadequate IDSA guidelines are what all mainstream doctors seem to follow. Most doctors will not give any antibiotics without a positive test. Well, I haven't found that to be true. We know that it can take weeks to get a positive test, and many people with Lyme never test positive at all, which is an excellent point. Yeah. However, I will say I was given a prophylactic dose of antibiotics, 2 doxycycline to take, because I did have an attached tick. That was twice, so I never had a positive test. Dr. Cameron, could you address her concerns?
Well, even a simple thing like a tick bite, where don't have a rash yet, you're not sick yet, even there's division among doctors there.
Whether what I got was adequate or not.
Yeah, because if you had talked to me, I would have said, when they did that study of 2 doxycycline pills, a one-time 2 pills, they didn't follow those patients more than 5 weeks. They didn't look for chronic neurologic. They didn't look for post-Lyme. So I can't be comfortable that you've prevented any long-term issues, any chronic issues. All I know is it can prevent rashes. It might even mess up the test. So I can't feel comfortable with that. Whereas other doctors with the same facts do 2 doxycycline pills. What I do is I figure I treat the same time I would for a rash. At least 3 to 4 weeks and a follow-up. And I want that follow-up to make sure everything went smooth. I think so much of Lyme would be solved if you always had them come back. I always have people come back for bladder infection, for when I have bronchitis, pneumonia. But
don't doctors just assume that you didn't come back, so you must be doing okay?
well, Lyme, they don't expect them to come back. They send them to a psychiatrist. They send them to some other specialist. And if you just have accountability and say, I'm going to take charge of you, don't worry, I'll follow you. Even if I send you to a psychiatrist, you come back to me so I make sure it works. I want to make sure that if you think that much psychiatric problem, that they're feeling the pain, the fatigue, the headaches, the numbness in the hands and feet, they can't concentrate, can't focus. If you think it's psychiatric, you should still have them come back and make sure it works.
Okay, so you are what Julia would refer to as a Lyme literate medical doctor.
Sure.
And my doctor, as I told you, gave me the two doses of doxycycline to take in one day. Okay, Julia, how do you find someone that would be considered a Lyme literate?
Well, sure. There's two things. One is we've run now 2 medical conferences in Pennsylvania, and the first year was sold out, and this year was just a few weeks ago, and we went up quite significantly in our attendance. What we're seeing is coming to those conferences are now your average doctor that is frustrated because they know their patients aren't getting better. And in fact, the inspiration for this conference was because we had doctors calling the patient support group, trying to get information and trying to find resources that could help them help their patients. So there's clearly a gap here in medical care for patients. And you know, it's funny because in medicine, there's never just one way to treat anything. There are always multiple approaches and multiple schools of thought. And in fact, patients are supposed to be told about those different schools of thought, and they're supposed to make the decision. So I think, you know, in order to find a physician, there are resources available. ILADS has a referral process, so you can go to their website and get a referral. And our organization, PA Lyme Resource Network, also has a referral line. I think you're going to post our number. You can call and we will refer you to doctors who are more knowledgeable in these diseases.
I think it's interesting because I know that your organization has pushed for legislation in Pennsylvania, and
that's right.
Senator Stuart Greenleaf is working on something that would help to educate Pennsylvanians about the incidence of Lyme disease and how to prevent it. But in places like, I think it's Virginia, it's a state law that physicians have to tell their patients, you may get a negative test result for Lyme disease, but that doesn't mean that you don't have it.
Yeah, that's right. That's right.
Interesting.
Actually, there are 5 or 6 states now that have passed legislation related to these issues in Lyme disease. And yes, I think it's important to know the question from the caller was about what can you do. There are 2 schools of thought. So number one, you should advocate for yourself, that there are multiple views and you are the one. You should advocate for yourself and ask to be treated the way you think is right for you. Do your research. And then secondly, there's been a legislative effort for a number of years, and I actually saw an article when I was sick about Senator Greenleaf, who happens to be my senator, and we engaged and created an organization called Lyme Action PA, and there's active legislation that passed the Senate last year, a first piece of legislation, and it's waiting now for the House action. So you should talk to your legislators. You should talk about, you know, the tick problems that you have. You should talk about access to treatment and education, all of those things, and make sure that they're conveying those messages in Harrisburg.
Okay, I think we have time for Michelle's question from Altoona. Go ahead, please, Michelle.
Yes, where do you purchase the tick remover that you showed on TV?
Okay, that's a good question. I actually ordered this online, and it's called Tick Twister, and there are lots of them out there, but I found it online is all I can tell you. But perhaps Dr. Huffman can tell our caller where to get these things.
They are at some local sporting goods stores. I know Dunkelberger's in Stroudsburg does sell them. If they want to send us go to our website, which is the lymeaidkit.com, and we can provide, you can access and purchase those the kits from that website.
And if you look at our website right now, you'll find that information as well. We have just about 3 minutes remaining, and I'm sorry I don't have time to take another phone call. I apologize for that. We'll have to do this program again. But I'd like to just sort of go around the horn here and get your final advice for anyone who is struggling with Lyme disease. Julia.
Sure. I think it's really critical to educate yourself and to advocate advocate for your health. In our case, my son, we were lucky. Our physician ordered a SPECT scan, and it had very objective evidence. There was an area of his brain that had no blood flow. So very objective evidence. He lost 23 points on his IQ. My daughter developed dyslexia. All of our children are functional, and in fact, in enrichment programs, they've recovered. But the cognitive and the neuropsychological impact on children in particular can be very significant. And you might think it's just a normal kind of behavioral issue with your child. So my advice to anyone is that if you see a change in your children or your family, that you research it and you advocate for yourself, because this disease and all of them are still emerging.
All right.
So it's not done.
Dr. Cameron.
I was very encouraged because I spoke in Hershey on Lyme disease 2 weeks ago, that I saw a lot of doctors reminded me of myself in the late 80s, that making that transition from regular medicine, traditional medicine, and open your eyes on what are the opportunities, what kind of patients that I missed, didn't see, thought it was something else. And if I just look at it a different way, all of a sudden there's so much literature there to allow a doctor like myself and them to make that transition.
All right, Dr. Huffman, just a couple of seconds, just your final thoughts or advice to our listeners and viewers.
My final thought would be that if you do have the tick that you have removed, save it, because we can always test it for other pathogens. If it may not have Lyme, it may have Bartonella, it may have Babesia, and that's important information. The DNA doesn't go away from those pathogens in the tick, so if they are put in a little Ziploc bag and you can freeze them, we can always test them to see what other pathogens might be present.
Excellent. I'm so glad you said that, but don't put them in formaldehyde. That's correct, I think. Thank you all so much for being with us tonight. Our guests have been Julia Wagner. She is the founder and president of the Pennsylvania Lyme Resource Network. Dr. Daniel Cameron, president of the International Lyme and Associated Diseases Society, and Professor Jane Huffman, director of the Northeast Wildlife DNA Laboratory at East Stroudsburg University. For resources on tonight's topic, visit our website at wpsu.org/conversationslive. We hope you'll join us for our May 15th call-in. We'll be talking about gardening and taking your questions. Thank you all so much for watching and listening. I'm Patty Satalia. For all of us here at WPSU, have a good night.